and she's currently intercalating in population medicine between her 4th and 5th year of study. She's got a keen interest in inclusion health and healthcare development for disadvantaged populations, particularly in areas of refugee and asylum seeker healthcare. And that was one of her main reasons to study medicine in the first place. So we're very lucky to have Lara speaking for us today. She'll be talking to us about a resource that she's created for GPs about managing homeless patients in primary care. And she created this during her 3rd year for her student selected component, and now it's being converted into a CPD module. Thank you, Lara. And our second speaker is Samraj, and I will introduce Samraj after we've had Lara's talk. So over to you, Lara.
Thank you, Jan. Let me just get a PowerPoint up, which has vanished, helpfully enough. One moment, everybody. Jan, do you want to introduce Sam while I just find where my PowerPoint has disappeared to?
Yeah, sure. Also, if you want me to help sharing or anything, I can help that as well. Help you with that as well. So while Lara's finding her PowerPoint, I will introduce Samraj, who's our second speaker, who's also just appeared on the screen. So Samraj Bhullar is from Hull York Medical School, and he's between his 4th and 5th year of study, and he'll be sharing with us an e-module that provides a comprehensive understanding of homelessness, and it aims to help participants deliver holistic care to those experiencing homelessness. The e-module is targeted at healthcare students, so I think a lot of us on this call who have no prior teaching on homelessness, and it's not within their medical school or healthcare student curriculum. And just for those wishing to acquire a more well-rounded understanding of inclusion health. So during the presentation, Samraj will be exploring when, how and why the e-module was created, and also discuss how it's being used now, which is very exciting. I don't know if you found your PowerPoint, Lara. Perfect. I think we can. Oh, it's just gone.
Yeah, I had it and then I lost it. 1 second. It is. We do. If you'd like. There we go. We got it.
Cool.
Just loading. Sorry, everyone. We love a false start.
It's not Teams if we don't have this kind of start, is it?
It's so true. It is just loading.
If anyone wanted to like introduce themselves in the chat as well, kind of say what healthcare professional background they're from and things like that, that'll be nice as well.
There we go. Can you now see that?
Yes, we can see that.
Fabulous. So yeah, thanks everyone again for coming and taking the time. And like Jan said, my name's Lara. I'm at Cardiff Uni. I'm intercalating between my 4th and 5th years in population medicine. And I'm going to be talking a bit about e-learning resources in inclusion health generally, and then talking about a project that I specifically did in my 3rd year. So firstly, for anybody who is newer and doesn't fully know what inclusion health is, neither do a lot of people, and it isn't 100% defined clearly, but in one key paper, it's defined as a research, service and policy agenda aiming to prevent and redress health and social inequities among the most vulnerable and marginalised in the community. And in some quite recent NICE guidance, they define inclusion health as a term developed to address the health and care needs of groups that are traditionally excluded, which includes people experiencing homelessness. And the reason I included that specifically is that that is the inclusion health group that my project that I'm going to talk about addresses. But other groups like vulnerable migrants, refugees and asylum seekers, sex workers, are also typically included within the bracket of inclusion health groups. So why do online resources matter, and why do they particularly matter within inclusion healthcare? So firstly, inclusion health isn't commonly covered in mainstream training tracks, either within medical schools in the curriculum or in training programs after you graduate and during work. There isn't usually space in curriculums for covering more niche topics that only apply to small numbers of the population or that aren't deemed as significant, and inclusion health often falls into that bracket. So online resources provide an opportunity for people with an interest to explore this in more depth, both for students and for professionals. And they're usually quite accessible. Online resources also remove financial barriers, as they can usually be provided for free, and geographical barriers that an in-person conference, for example, that might usually provide this kind of more niche or specialist knowledge base might provide, because people can engage with this at their own convenience around their working patterns and don't have to pay out for it, essentially, either in terms of time off work or paying for the actual content. Online resources also allow a wider distribution of a more specific knowledge base. It removes the need to be in sort of the right place at the right time with the right expert in your university or in your hospital in order to gain a better understanding and insight into a specific knowledge area, which is really important for something like inclusion healthcare, where there are specialists and there are experts in the field, but there might not be somebody near where you are. And so creating online resources to target specific areas within inclusion health allows for that knowledge to be shared and accumulated by a greater proportion of the healthcare professionals around the country. So what was my project? I created a Xerti e-learning module about managing patients in primary care, which was targeted at GPs and GP trainees, specifically working within the Cardiff and Vale University Health Board. I did this in my Year 3 SSC project, so a couple of years ago now. And the reason that this project was deemed to be important was because when speaking with GPs particularly, and also some primary care nurses, at the beginning of the project, there was a real lack of confidence expressed when it came to managing homeless patients. And they were describing these patients as quite challenging or problematic, or even within specialist services, some particularly newer members of staff found it very difficult to know how best to provide care for their homeless patient population. So that was one reason, just a lack of confidence. And secondly, in Cardiff, there is quite good service provision for the homeless, both in terms of social care and healthcare. But those specialist services aren't very well known by mainstream healthcare providers. And so this module, this e-learning resource, was designed to compile all of that information, both some practical guidance and also just compile the information about what services are available to give mainstream healthcare providers some idea of where they can signpost their patients who they feel would benefit from some specialist service input. So background to how we got here. I knew I wanted my SSC to be with either homeless or refugee-based populations. Cardiff has quite a high number of both of those. And so I approached someone within the medical school who I thought would be able to help me find a relevant tutor who would be interested. She put me in touch with a GP who she knew, Dr. Heleth Jones, who was interested in this field and works at a GP practice where they have quite a high proportion of homeless patients, and a couple of GPs with a special interest. And as we started talking about what we could do for this project, it was identified that creating a training resource would probably be more beneficial than a traditional Cardiff SSE audit service evaluation style project, because there was a lack of knowledge. So creating a learning resource was more valuable use of time. And there were two of us who were interested in this similar area and who were working, being supervised by Dr. Jones. And one of us was to focus on a resource for medical students that could be embedded into the Cardiff C21 curriculum. And one of us was going to do a resource for GPs. And that is the project that I took on. So to begin with, The process was that myself and Anna, the other student, and Dr. Jones planned out what the overview of the project would look like. And so there were two key elements. The first was meeting with local service providers, national leaders in the area, and experts by experience. So we hope to arrange either meetings virtually or in person, or if possible, short placement days with service providers to gain an understanding of how services in Cardiff fitted together, as well as supplementing background research into care for the homeless more generally. We then began collecting information and details for those relevant service providers and started arranging our meetings with them. Those meetings and placement days then happened, and they were really valuable and really interesting. So we met with people like there are specialist homeless nurses in Cardiff. We met with members of Cardiff Council and housing associations, people who work in various homeless hostels around Cardiff, as well as some GPs who work at practices with higher homeless patient populations, as well as the medical director of CAVIS, which is Cardiff Health Inclusion Service. And also we met particularly when we were doing placement days at CAVIS and with the homeless nurses and with the bloodborne virus team. We met some really, really interesting people who are experts by experience and got to chat to them, which was really, really insightful and really useful. The first half of the project, we spent most of our time doing this, but at the same time, we had background research that was ongoing. So we were looking into resources published by places like Pathway, into care for the homeless, trauma-informed care, things like that. And as we discovered things that were relevant through our meetings with service providers, then we would look into those things more specifically. When it came to about halfway through, we had to learn how to use Xerti and how to create a resource, which was new and slightly challenging. But once we got the hang of it, it was quite user-friendly. It doesn't involve any coding. And we chose Xerti partly because we have free access to it through the university. So if anyone is thinking of creating any resources at any point, it's worth looking into what you have access to through uni. And then coming into content creation, we had to start nailing down what the content of our individual projects was going to be. And this was quite challenging, thinking about the structure, and there's so much information to put in, what was priority. And that did change as the project went on, and as I started putting together the module, getting feedback and getting a better feel for how things fitted together. And putting everything together did take longer than anticipated. So again, little golden nugget, these things do take time. But overall, we ended up with an e-learning module that I'm actually very proud to have created. So the result was a comprehensive e-learning module for GPs and GP trainees about managing homeless patients. It is long. It takes about 2 hours to work through in total if you engage fully with all the interactive elements and the videos that are embedded within it, but it can be done more quickly if you just take in the content that's written. I included case studies which were based on real life stories that I heard from people I encountered, interactive pages, quizzes, videos, and downloadable guidance, as well as some detailed outlines of what the locally available services are. And in the next few slides, I've got some screenshots of some key parts that I think are important to the module, broken down into sections. But I have put the link on this slide, and if we can distribute the slides afterwards, then you'll be able to access that. Or if anybody's interested in specifically having the link, I can post it in the chat after I'm done with the talk, if anybody wanted to go through it themselves. So the first thing I wanted to talk about was the local focus, because although this makes it harder in a way for it to be used Wales-wide or even UK-wide, I felt that having a local focus was really helpful, because for the SSC project, I was supposed to be focusing on Cardiff-based GPs. And also because there is such good service provision available if different services work together, I felt it was really worth collating all of that information into one place to coordinate care better, because there is a lot going on, but people didn't always know who to contact or who to signpost to and who was doing what. Also, there are a significant number of homeless people in Cardiff specifically within Wales, and those statistics are also in there as background detail. And although Wales is a small country, Cardiff is an asylum seeker dispersal city, which means that we have a lot of asylum seekers that get moved to Cardiff, and some of those, their asylum claims get put through, but some don't. And a lot of the asylum seekers whose claims get rejected end up street homeless in Cardiff, and they also need some specific support, which is also outlined. So that's why the local focus was important in this. Case studies were also a key part. There are two main case studies, John and Rosalind, who were based on people that I'd met. We followed John throughout the majority of the module, meet him at the beginning and work through doing different thought-based activities and information-based ones as we go through the module. So I use the case studies as thinking points for whoever's doing the module to challenge some of their assumptions, as well as highlighting some key challenges which might be faced by homeless patients, particularly the challenges that are intricately linked to healthcare. In the two that you can see, so the pale blue and the purple photos, the feature there is that you can identify areas within the text that highlight a challenge, and as the learner clicks on that part of text, information about what the challenge is, how to overcome it, and what local services available to help you do that appears in the bottom left corner. So different information only appears as relevant and as you identify the need for it. So within the case studies, as well as a thinking point as a story, there's lots of interactive elements there. Trauma and trauma-informed care and adverse childhood experiences are such a key element to consider in homeless care for the homeless and also the general population, but particularly within inclusion health groups. And so each of those, so trauma and theory, they're trauma-informed care and also adverse childhood experiences, each have a dedicated information page. And there's also included in the module a short graphic novel which depicts one author's experience of trauma for people to really engage with in a slightly different way to just words on a page. And that's available to download as well if people want to then distribute that further. Because this is one of the biggest things that people, particularly GPs, don't always think about, but is really vital to providing good care to all of our patients, really. And all throughout the Xerti, I mentioned earlier the interactive bits. There's quizzes, opinion polls, response boxes, sorting exercises. And although sometimes I know when I have uni things that have interactive elements, I am a little bit sad because it makes it take a lot longer. I also know that I remember the content a lot better. It's easier to engage with, and education research tells us the same thing. So again, it was something that I was really advised to consider, was keeping plenty of interactivity throughout the module to keep engagement high and cogs turning. And another thing that I thought was important was integrating guidelines and tools that people can download and then keep. So the ones on the right-hand side are more general, so the mental health assessment for rough sleepers, trauma-informed practice, and the standards for GP receptionists. They're produced, two of them by Pathway, and they are more general national guidance that anybody can use anywhere. And the three on the left-hand side are Cardiff specific. The top two are health board resources about two existing services that GP practices can sign up to be a part of. And the bottom file is a directory that I put together as part of the project, which compiles contact details and descriptions of all the health or health-related services which serve the homeless in Cardiff. It also includes names and details of all the major homeless shelters, day centres and supported accommodation in and around the city. And the point of including them in this directory was so that, particularly for GPs or GP receptionists, if they notice that one of those addresses is named in their patient information, can make a note that this person might be homeless or at risk of homelessness, and so may need some direction to specialist services, or at least to be asked potentially about their social situation if that is influencing the care that they require. And if you look in the middle and the orange box, That directory was one of the major elements of the project that was most useful to the health board as a whole, and it formed quite a large component of what my project ended up being. It was almost as important as the module itself, because that directory has been included in the homeless patient care pathway created by CAVIS, so the Health Inclusion Service in Cardiff. And they act as a central hub for any specific inclusion health work in Cardiff, and they have these pathways for different inclusion health groups, and this directory is a part of the homeless patient care pathway. Other things that have happened with this project going forward was that myself and Anna, the other student, were invited to speak at the Year 2 Global Health SSC about health inequalities and inclusion health, and Anna was able to share her resource that she created with those Year 2 students, and that module is now included in that SSC every year, and is being put into our Vulnerable Patients Week that we do in our 3rd year. For myself, then, the most exciting thing is that Dr. Jones was able to share my resource with Health Education and Improvement for Wales, or HEW, which is the body that coordinates all the training programmes within Cardiff and Vale Health Board. And as a result of that, I was invited to give 2 training presentations to GP trainees in the Health Board, which was a really quite a surreal experience for me as a little 3rd year, presenting this teaching presentation to doctors who'd been qualified for like 2 or 3 years at least already, just because it was an area that was recognised as a need, and that hadn't been addressed before. And that was amazing. I felt really honoured to have been invited to give that teaching presentation. HEW also approached me, and they wanted to use the module to publish on their website, which is the hub for online resources for GPs in Wales. And some trusts in England also use some of the HEW resources. So at the moment, my Year 3 SSC project is being converted into a format compatible for their website, and is in the process of being accredited as an official CPD module, which is really, really exciting. And at some point within the next year, that will officially go live and be published. And for me, the fact that this was being used in real life and was actually potentially going to impact service provision and care for patients was a massive thing and was really exciting. But also additional information that I didn't know whether to include or not, but thought for the sake of transparency I probably should, was that HEW did pay me for my content. And I also include that just to say that if you do create something that you think has value, it is worth pushing some doors and seeing if there is a way to publicise it, because firstly, you never know who might be interested and who it might impact. And secondly, you never know, you might get paid for uni work, which was just an icing on the cake. So some learning points for myself and anybody else who might be interested in doing something like this in the future. Firstly, Xerti is fiddly, but it is free, and once you get your head around it, it's quite simple. And like I said earlier, content creation is time consuming, so make sure if you are doing a project like this, give yourself more time than you think for putting things together. Also, if you don't know where to start with looking for opportunities like this, there are always people in and around hospitals who could do with a medical student to help them do a project. SSCs are great for this. Intercalated projects might give you some scope for flexibility within it. Also electives, depending on how your programme runs, there might be time for you to do research or create something alongside your elective placement. And even if you find the right person at the right time, just alongside normal medical school, there'll probably be a project running that you can join in with in some capacity. And like I just said, if you do spend some time on a project to make it high quality, it really is worth it. Yes, it's more effort, but it is worth it, both for a good addition on a CV, and because if you do testing some doors and you're persistent, you never know what your work might be able to contribute to and might be able to be used for. So thank you for listening. I'm happy to take any questions if anyone has any. Otherwise, hand over back to Jan.
Thank you so much, Lara. That was very inspiring and very informative of like the whole process, and also it's so cool what it's like come to that there's like you were giving talks to GPs and everything. That's pretty cool. And it'll be nice to like do that kind of stuff as well with our like student branch and have that teaching available for other students who are interested as well. I don't know if there are any questions. We can open up to the floor for a bit, or Chris, if you've got anything to say as well.
I was just going to ask a question, actually, if nobody else did. Looked absolutely fantastic, beautifully presented, and really well put together. I think my question was, because some of it's applicable everywhere and some of it's more local, could there be a way of people sort of localizing it for their area with the bits that are local, and would you be happy for people to do that, basically?
Yeah, I think there's definitely ways to do it. A lot of the local information is integrated through the module as well as the specific like downloadable bits.
Yeah.
But there are definitely ways. So for example, I reference the community addictions unit that we have and the homeless nurse walking clinics that run, and there's a homeless MDT run by the council. And where if somebody wanted to adapt it, just the places where I reference those specific things might just be sort of a trigger point to look at, okay, what equivalent do I have in my area, and just swap it. Yeah, and when in the conversion to the CPD module, it is being slightly more generalized. That's part of the process that we're going through with converting it, is making it slightly more Wales specific, but that's again more generalizable. But yeah, definitely, I'm very happy for it to be used as a template. You can't edit it directly because the Xerti file can only be shared in its completed form, but as a template, please use it all you like.
Great, thank you. And you're happy for people to go through the link and do the training?
Yeah,
and things
absolutely.
and
Shall I
Cardiff
share the
trip?
link directly in the chat now?
I think that'd be nice. Are you happy for that? Because obviously once this is loaded up onto wherever it goes onto the website, anybody will be able to see it. But if you're happy for people to use it,
absolutely, I'll share that now.
Thank you. Thanks, Jen.
Thank you, Chris. And I also just saw that you put in the chat about if anyone would like to be added to the invitation list for the next talks. Please put your email address and name in the chat. We also have a Google form, if that's easier as well. You can put in your name, email address, and so we've got it kind of collated. I'll just put the link in the chat as well after Lara's, which will help us kind of give you more information about when we have further webinars and other things that are happening in the faculty. If there aren't any more questions, I'll hand it over to Samraj. And we'll have some time for more questions at the end as well. Is Sam in the chat?
He was.
I think it's just said that he left, so I don't know if he meant to share and ended up clicking leave.
Should I try invite him again?
I think he's just come back.
There he is.
Sorry guys, I went to remove one of the message pop-ups in the corner. It was on top of the leave button. I wasn't trying to run away. Right, let me pull up my PowerPoint as well. Okay. So are you able to see my screen now?
Yeah, it's a blank white slide. Is that what it's supposed to be?
Sharing is paused. Actually, let me just try once more. Okay, is it working now?
Yeah, you can see that.
Okay. Yeah, thanks, Lara. I'll go through a bit about what I've made as well. So basically what I made, similar to what Jan had introduced as well, was an e-learning module that I wanted to give a comprehensive understanding of homeless healthcare, because for me as a student, I had a lot of questions about different areas, and it wasn't all exactly aggregated into one common place that you could find all this information. And I had a lot of questions, and I'm sure a lot of the students alongside me had questions, and other students at other medical schools did. So that's what I wanted to create, and it was targeted at medical students in particular at the beginning, but generally opened up to healthcare students in particular that could use this material going forward and feel like they could feel empowered to address health inequalities experienced by this inclusion health group. So I've just included a bit of the content on the side here. So things like causes of homelessness, housing issues and legislation, health inequalities in healthcare, intersectional experiences of homelessness, culture of homelessness, and what can you do? And these are all common things that I literally had no idea about, especially housing issues and legislation. Things like that I was really interested about, but seemed really complicated to me, but I really wanted to make it understandable, not only for me, but for other healthcare students that wanted to be involved in this. Okay. So why was it important in particular to create it for students was because we know there's long-standing health inequalities experienced by people experiencing homelessness, especially being difficult to care for these patients in our siloed healthcare system. So it was important for me to create students that were prospective doctors that had the skills and knowledge to be able to care for these patient groups, but not only doctors actually, but healthcare professionals altogether that were equipped with these skills going forward into their professions, that I had awareness that it wasn't just one facet, and actually there was lots of little components going on when we wanted to care for someone, and not just the health, but also the social that we had to tackle as well, because they're both linked. Okay, so this project was going on for quite some time before, but it was something that I picked up again in my SSC during my 4th year of uni. So it was during October time that it got picked up again with my tutor, and I said that I wanted to finish this e-module or this teaching workshop almost for people experiencing homelessness. And so we sat down with it again October of my 4th year and started making a real plan, and I had time put away that I could really dedicate to this. So as you can see here, I did a basic search basically on Google Scholar, had some basic mesh terms and just some basic ideas to start with. And I just did a whole massive research of different things and had different articles pulled up on one side of my screen and a Word document on the other. And I basically transferred pieces of information over that I thought were important, and interesting as well. And I made this massive form that was many pages long with lots of different information. And then later on in November, I started to categorize it into themes where I thought were chunks of information that were grouped together. And then that formed an outline of the e-module. And I'll show you this on the next page as well. So that formed an outline and the contents of what should be included in the e-module. And it answered some of the questions I had, but also through reading and doing the literature research, brought up other content that I thought would be important that initially wasn't on my mind. And then from December to January, I created the module using Articulate 360, which is e-learning module platform. It is a paid platform, but it was something I was able to use because it was being paid for by my supervisor at the time. Yeah, so it was a bit fiddly as well, but thankfully I got the hang of it. And it was very useful actually. I really liked it. It looks really slick, so I'll give you guys a look at the end. And in February and March, I disseminated the module at some professionals in the field just to assess for the correctness of the material, the language that I was using, and I made those improvements shortly afterwards. So I'll just show you this massive Word document. So it was a Google Form document, and I just transferred lots of information over, and then later on towards the end of that month, I'd categorize it, and I made the contents page and group this information into headings. So similar to Lara, I'll explain how it's being used now as well. So hopefully it's going to be integrated with Pathway and Fair Health, which are both inclusion health platforms. We're currently discussing this dissemination of the e-module and how it might be used. I had plans to use the e-learning module as a means of delivering teaching to students and also surveying students about how they received the module, whether they'd received teaching on people experiencing homelessness, whether they found the e-module useful, and whether they'd like similar teaching. And I was hoping to do that at many universities, many medical schools, and aggregate this information and use it as sort of, I'm using the word, but use it as sort of a look at the current state of teaching on people experiencing homelessness, whether it's sufficient or whether we can do more. So that's what future prospects I had for this and how I might go about doing it as well. And also I had ideas of creating sort of like a crib sheet of how students themselves might be able to use this module and use it going forward, especially with the student committee we have now at Homeless. They could use this crib sheet, they could do their own reading about people experiencing homelessness and how they can use the module and deliver it at their own universities and gather their own feedback. And that's something as well, how I can see this going forward and how I'd like it to be used. So here are some considerations, maybe if you wanted to create your own online resources, especially things that I was considering at the time I was making mine. So I was told to have clear aims and objectives. So that's my learning outcomes. What I really wanted to achieve, what did I want the participant to leave with, what knowledge, what feeling did I want them to leave with, and who was it for specifically. And it was really important to maintain the user's attention throughout the e-module as they went along. So making sure I had bite-sized information, it wasn't overwhelming, especially because some of the content and some of the subjects, there's so much information out there and you can go into so much depth about it that you can get lost in about it. So it's really important just to keep it to the bare minimum so it was understandable, and you wouldn't get bored in between it as well. And I included lots of graphics and interactive material and videos in between information to make it easier to stick along with rather than just having massive text. Also, sometimes you might want to include pre-work potentially for creating your own online resource. If you had some pre-reading to accompany it with it, I was asked if I wanted something like that as well. But I thought sometimes when I've had pre-reading before lectures, it becomes a bit too taxing and it might deter some people. So I decided against it, but instead had some further reading that students could go into at the end of the module instead. So here I put visually pleasing a design. So like your color design, your color pattern, what you'd want it to be. I knew that I wanted mine would be used by Pathway eventually, and I've designed it for Pathway. So I've kept the same sort of color theme as you'll see later on. And it's also important to think about who's involved in creating the content and who's assessing for the correctness of it. So this could be, you could be students, could be professionals in the field, it could be patients by experience. You want to really, especially when you're creating inclusion health content, I think it's important to know whose voices are being heard at the table, and whether it's appropriate what's being included and whether you've got everything you need. And then moving on, so we had who will deliver their teaching. So initially I thought I wanted this e-module or this teaching to be delivered by a professional in the field, because me as a student, I've never cared for someone who's homeless, and it didn't seem appropriate for me to inform students about how to go about that. And I thought, okay, so maybe I could have professionals who have cared for people experiencing homelessness deliver it. But that wasn't very appropriate because they might not be available every year or every time we want to deliver the teaching. So I thought maybe we could move on to pre-recorded videos of people delivering the teaching and have that integrated out the e-module. But then that became unfeasible given the time schedule I was in for my SSC. So the e-module instead was created by information I found, and it was informed by what professionals had told me when I'd given it to them. And then you want to think about how you're going to end your e-module, because this is the ending that people are going to remember and it'll be the most impactful, you'd hope as well. And I knew I wanted students to come away with some real points, some like real action points they could do to affect change. Because sometimes we deliver content on saying what things are, but we don't see how things we can change it, how we can actually go about it. So I really want some concrete steps for students to affect change, but also make them feel empowered that they could do this, rather accept inequality as a matter of fact, and it just is what it is, but instead it is something that we can change. Okay, so I'll give you a look at the module now. So just include a bit here on the contents on the left here that you can see. So we'll go through this in part. So this is the definitions section. So I've not included every little bit, but a little whiz-stop tour of it. So I've included statutory homeless here, and it includes hyperlinks here to different websites and different resources that the participant can click on and read a bit more on if they were interested. And for each definition of homelessness, I included statistics to contextualize this a bit. And then the blended conceptual framework and categorical framework was explaining how people that actually become homeless, demonstrating that actually it can happen to anybody. And yeah, it was something that I found quite difficult to understand initially without doing this reading. So it's important for me to include it. And as you can see, they were interactive as well. Like you can click on these and find out more information about the structural factors and the personal factors. And later on, it would go on to explain different housing structures and how that impact whether someone became homeless, the economic structures, and also the legislation and how that influences people's pathways in and out of homelessness, and things that were really important to include, even though not necessarily speaking about healthcare and health and the state of the body. They're really important to include because, as we said, the social impacts the health, and without addressing the social part, the health will stay where it is. So I really wanted to include this, and it's something I found forever confusing. So I hope I've done a good job of dwindling it down and making it understandable. So here again, you can see more hyperlinks into other websites, other foundations doing great work, and video clips to sort of contextualize and understand this information a bit better as well. So this moves on to the healthcare. So trimorbidity is a huge thing for caring for people that are homeless. As often they can experience physical, mental health issues as well as substance misuse issues. And all these make it really hard to manage just one aspect of health, as they each create a little cycle I've tried to demonstrate in the picture here that makes each of them much harder to deal with and much harder to manage and treat. And in the top, I've included a bit of statistics and information from important research that actually demonstrates sometimes we think a lot of the deaths that people have, a lot of deaths homeless people experience is due to substance misuse or alcohol. And although it might be true, actually a large significant number of the deaths are due to chronic disease, things like heart disease, respiratory disease, that we can do something about and are treatable, but actually go amiss a lot of the time. These are some other aspects that are seldom thought of, so palliative care and dental health, and then barriers to healthcare. And then there's film Clarissa, Backgrounds, well, I think it is, that demonstrates these barriers to healthcare and really helps contextualize it and breaks up this information a bit better as well. And I've included trauma as well, like Lara had mentioned, really, really important part in understanding patients and their responses. And it talks about adverse childhood events as well, and how we can create a trauma-informed environment. And it has links here into the documents that specify further in more information how we can actually go about this if the user wanted to explore it a bit more as well. And a sense of belonging. So this is something that wasn't widely written in the literature, but it's something that I sort of had an idea about or came to understand after I came back from intercalation, and wanted to understand sort of the culture of homelessness and what it meant to have like a shared identity amongst other people that are sleeping rough or maybe experiencing homelessness, and how this shared identity is almost formed, and because you have these similar experiences, and it can make it sometimes harder to leave the community you formed to progress further. And although you want to, it could be hard to leave those attachments. So I talked about intersectional experiences of homelessness as well, because sometimes I think we see homelessness as just a male attribute. How I'd explain this, but in fact, the experience of homelessness is different if you're a female or if you're a migrant as well, and especially if you're young or if you're a family as well. That I haven't included here, unfortunately. But with each case study, I'd write a little story about patients that I had experienced or heard of, or about other professionals from other professionals' interactions with people that are homeless. And each we've used as a vehicle for more information, or a vehicle to actually put the information we've learned in the module in place into practice. So I've not included each case study here, but just little snippets of each of them so we have an idea. So each had a case study, and it was followed by key questions that the user would think about, make their own notes of, and then we go on to answer them. So for example, with male homelessness, what are some reasons why people could be agitated in healthcare settings, which is a huge topic, and sometimes we're quick to judge people, especially we can hear in healthcare settings, and really, really affects the care we give. But in fact, anybody can become agitated in a healthcare setting, and it really aims to tackle these misconceptions we might have. In the middle, we can see how the experience of being a homeless female is different to a homeless male, because actually the pathway into homelessness, it can be different. Sleeping rough can be different, and also the idea of identity conflict and the societal conceptions of what a woman should be as a mother, as a caretaker, and sort of that turmoil inside and how it can affect people differently. It was important that I wanted to bring up through this as well. And on the right here, what are some issues specific faced to non-EU migrants as well? And we talked about the mixed health needs in the journey a migrant might take, in the unmanaged chronic disease they may have, and the communicable diseases as well. This image was taken by the BMA, their toolkit, which is really, really handy, that I've linked in here as well. We talk about no recourse to public fund as well, and the move-on period, the 28 days in which a refugee must find accommodation for themselves once they've been given settlement status. So you can see I've touched on a lot of different key aspects, and although it's not in massive detail, it's important to me that I wanted to give this really idea, this big comprehensive understanding that touched on these little different topics within homelessness and how big it could be. And we've got here as well, back in the left corner, how should Harry's care be managed? So not only case studies are the vehicle for knowledge, but actually how do we put action into place as well? And each case study finishes with what's the most important lesson to take away from the case study. So in this case, it was that we didn't want Harry to leave the hospital, because in fact he's very much more likely to be very sick, more sick than the next patient that comes into A&E because of it is the unmanaged health. Okay, and then this comes to end with the 9 steps that students can take in real time as students or as professionals to improve the healthcare of homeless patients they might see. And then it finishes with a reflection video here at the end, created by Carmen Schumann, that she kindly allowed us to use in this as well. Really emotive video, really, really, really well made. And alongside it are some questions here, just to summarize their feelings and their thoughts about what they had about the E-module, about their own experiences with inclusion health groups and people experiencing homelessness. And they share it in this Padlet discussion board where they can add their own thoughts, contribute onto others, and read what others have written as well. And at the end here, me and Lara thought it would be a good idea just to direct you guys to any other online resources that we knew of that you might want to look at as well. So I'll discuss the first 4 up here. So Fair Health have lots of resources as well, lots of e-learning modules that you can have a look at, and a podcast actually as well, which are really interesting. Pathway themselves have lots of e-learning resources on their website as well that we've linked here. Shelter has professional training webinars that you can look up online. And there's lots there as well. And I've linked Clarissa the Groundswell film that was in the e-learning module as well. I don't know if Lara wants to go through the ones that she's attached here as well.
Yeah, totally. So the 5 at the bottom are slightly more refugee asylum seeker focused. Obviously, the 2 groups are very linked. The first one is the BMA migrant toolkit that Sam already referenced, which is really helpful and has a lot of information about it, even just about sort of the basic rights that people are entitled to when they come to the country. And just is something that if you're ever on placement with people and come across this sort of situation, and whichever healthcare person you're with isn't aware of it, is really worth highlighting. The next 2 are courses, online courses you can do that aren't super long. They're sort of modular courses, not anything you have to pay for. But the first one is by the University of Minnesota. So some of it is less relevant because it's American, but the key concepts are still very good. And for anyone who is looking to do any kind of camp-based work, so not so much in the UK inclusion health, but any refugee camp or similar, there's a good course on the Unite website. Specific focus on mental health and well-being of, again, refugee asylum seeker, and they mentioned some homeless stuff specifically there. Not overall healthcare, but a really important element. And then the last one is just the Safe Surgery Scheme, which is a Doctors of the World scheme that, again, GP surgeries all across the UK can sign up to, which just Doctors of the World, if you've not heard of them, it's kind of similar to MSF or Doctors Without Borders, if you've heard of them. It's a similar kind of organisation, but that does more long-term work and less relief work. And they deliver training to GP practices who want to be more inclusive or safe surgeries. And that's a really good scheme. Again, if you're on GP placements, I really encourage you to speak to the GPs that you're with or any of the practice managers if they're aware of it. And if they're not aware of it, why not? And really encourage them to sign up or look into becoming a Doctor of the World Safe Surgery. So those links are all really important ones.
Cool, and I think that brings us to an end. So I'll stop presenting now.
Thank you both so much. I love how you've created these amazing resources from just having these questions yourself, and now answered them questions for a lot of people that would have gone through the same thought process as you both. I don't know if there are any questions open to the floor. You can put it in the chat or raise your hand or just unmute, whatever you want.
What's the best way of getting access to your resource, Samraj? Is it through the Pathway website? Is it on the website now? I probably should know that, but
not quite yet. I think we're having a meeting soon to discuss the dissemination of it, but I'm welcome to put the link in here as well.
Okay,
yes.
That'd be great. Thank you.
Yeah.
I mean, I think they're both amazing examples of fantastic resources that bring so much together. So not only is it the content that you've got in there, both yours and Lara's, but it's all the links to all the other resources as well. I think it's amazing what you've both done, to be honest. And my GP surgery is a safe surgery, so I ought to say that too. Any questions or comments from anybody else? I agree, John.
If there aren't any questions, Chris, is all right. I think someone's typing in the chat. I was just gonna summarize what the student committee is as well, and kind of encourage everyone in the chat to join us.
Yeah.
So basically, this talk is part of a webinar series that the student branch of the Faculty of Homelessness and Inclusion Health, which is always a mouthful to say, that we've kind of tried to start, and we want to collaborate with all medical schools and other healthcare professional bodies and other nursing, physicians associates. So like all of the students that are interested in inclusion health, we kind of want this to be the hub. And so we'd love anyone in this chat who isn't already part of the committee to join if you'd like. And the link for the forms is in the chat, so please fill that in. And if there's anything that you want us to discuss further in the future or any other talks, please let us know. Our next webinar, I think, is on the 13th of February. So please keep that date in your diaries. And hopefully we'll see new faces as part of the committee and see you all next time as well.
Thanks so much. Thanks for the presentation and thanks for the chairing, Jan. That's brilliant all round. Have a great evening, everybody.
There's a lot of very inspiring projects coming in the chat.
Fantastic. And
Thank
if
you.
you sign up to the faculty, then you'll get our newsletter as well, which has other events and things going on, and we'll tell you about the student events that are coming up as well. So yeah, do sign up. Thank you all so much. Have a good evening. See you soon.
Bye.
Bye.